Hello, my name is Ayden Lupo, and today we're going to be talking about the reality of lung cancer. Lung cancer is a cancer that begins in the lungs and most often occurs in people who smoke. There are two major types of lung cancer, which are non-small cell lung cancer and small cell lung cancer. Causes of lung cancer can include smoking, secondhand smoke, exposure to certain toxins, and a family past of lung cancer. Symptoms include cough with blood, chest pain, wheezing, and weight loss. These symptoms often don't appear until the cancer is advanced. Treatments vary but may include surgery, chemotherapy, radiation therapy, targeted drug therapy, and immunotherapy. In addition, lung cancer is one of the leading causes of death in America for people over 65. Hello. In this slide, we're going to be talking about some signs and symptoms that vary throughout lung cancer. The main sign of lung cancer, or people complain of, is a cough that is persistent and doesn't go away. In addition, with that, there's a lot of coughing up rusted colors type phlegm and spit. Also, persistent chest pain while breathing, coughing, and laughing is another one of people's main side effects and symptoms of lung cancer. Also, a lot of people experience a lot of unexplainable weight loss and a loss of appetite if they have any form of cancer, on top, like especially lung cancer. Also, another symptom and sign to get checked for lung cancer could be like hoarseness and shortness of breath, or anything like of that sort where you're just kind of like out of it, can't really breathe as well. Then tiredness and fatigue also pile on top of that list, with not just alone lung cancer but other cancers as well. Then wheezing is a huge sign and symptom, or like one of the bigger kind of signs and symptoms for getting checked out for lung cancer. And then one of the big kind of giveaways I was reading was infection, or some infections such as like pneumonia and bronchitis that won't go away, or they're like keep returning and they're very persistent. That's another sign that sign and symptom that you should go get checked out. There are a lot of risk factors and different things for lung cancer that can cause an increase in risk for getting the disease lung cancer. Some of these factors can be like smoking and stuff of that sort. So if you smoke, try to stay away from it, and if you don't smoke, don't pick it up. It's a really bad habit. Adding on to that, exposure to secondhand smoke and being around any type of like smoke or chemical smoke is really bad for your lungs, and you have a higher chance for exposure to lung cancer. In addition, previous radiation therapy, having like any previous radiation treatments done can result in like a way higher chance for contracting any type of cancer, and increases, if not graders, your chance for getting lung cancer. Also, there's this interesting thing called radon gas, and it comes from like soil, or the decay of radium in the soil under like houses and stuff, and exposure to like chemicals or like that are really bad and can give you a higher chance for leading back up to lung cancer and things of that sort. Also, exposure to carcinogens or other like asbestos, that can really, carcinogens are what's in cigarettes, so basically anything kind of smoking or any toxic chemical inhaling is another risk factor for lung cancer. Then one of the last ones, the pretty obvious, greater known one, is family history of lung cancer, if any past family member has had lung cancer or lung disease. There's also a lot of dangerous and kind of bad effects that come from lung cancer and things of that sort. Lung cancer has many negative effects, especially on the respiratory system and its function. So lung cancer usually slowly chips away at the lungs and can have multiple effects, including stuff is like shortness of breath, wheezing, to even pain in the chest areas and very areas of the chest. Also, alone from the respiratory issues, lung cancer poses a threat with like a lot of type of sickness that can derive from lung cancer. There's multiple, like including pneumonia, bronchitis, anything mainly respiratory can really stem from anything like lung cancer and stuff of that sort. Also, lung cancer can affect a healthy body structure and its function, because if it spreads to other body parts, it can way worsen your chance of possible other cancers and more intensing the stage of the cancer. But yeah, lung cancer patients usually experience a lot of effects and like symptoms such as fever, weakness, bone, muscle pain, joint pain, and things like reduced appetite resulting in weight loss. Um, just basically overall, there's a plethora of different symptoms that can derive from lung cancer and the causes that and the issues that it has to your body more than just the respiratory system, which some people think. On this slide, we're going to be discussing like diagnostic tests and tools to diagnose lung cancer. So first off, your cancer doctor and your team may need to take images and find and locate where the cancer is to even test it. So there's a lot of ways this imaging can be conducted, such ways like X-rays, PET scans, MRIs, and all this crazy stuff that uses magnetic fields, ultrasound, like sound waves and stuff like that. But first we'll get into what a PET scan is. So basically a PET scan, which is short for positron emission tomography, a positron emission tomography scan involves injecting you with a special tracer that collects in areas that have high chemical activity. Then in the test, the cancer spots, like the imaging back, the cancer spots will show up very bright on PET scans and like show you where there's highly collected areas for possible cancer and reasons to get it checked out. Secondly, we'll be looking at MRIs, which is short for magnetic resonance imaging. So MRIs basically use radio waves and strong magnets to look for possible cancer that is spread maybe further from the lungs, even directly to the brain or spinal cord as well. And then also X-rays are another huge way to locate and kind of directly find that cancer because of the angles and stuff, how many pictures you can take with X-rays. So X-rays are used to find lung cancer by using high energy electromagnetic radiation to provide specific images of the lungs and the surrounding tissues to the doctor. Also, the chest X-rays are very valuable in revealing possible abnormalities, such as shaded areas that may need to be like further evaluated to determine whether they're tumors or cancerous or not. And then that's one of those couple many ways you can get it checked out to see if you have any form of cancer, especially lung cancer. Today we'll be looking at kind of more of the diagnostic tests and tools to diagnose the lung cancer. So once you get any of those further imaging results done and your doctor wants to look at it more, most people, the lab testing, there'll be like a lab kind of biopsy kind of thing, or like where they find where the cancer is at and test it to see if it is cancerous or benign. The main one is called a bronchoscopy, which is when the doctors look for blockages possibly in the larger airways of your lungs. So it basically involves putting a bronchoscope, a thin flexible tube with a light and video camera down your throat and in your airways to have a look around to see what's up and what could possibly be wrong. Secondly, there's a lung biopsy, which is when your doctor conducts a procedure removing a small piece of tissue or fluid from the chest to check if it has cancerous cells possibly. Biopsies are conducted by surgical incisions performed with small needles usually. And there's a couple advantages of biopsies because there's not really a surgery. It's kind of just more like a procedure. It's kind of like 15 minutes or whatever. But sometimes it's risky because the sample isn't as big and it's not enough to define and diagnose where the cancer came from or if it is even cancerous. Third, there's like a thing called a thoracentesis or thoracentesis, is when your doctor suspects fluid building up in the lung, and it's causing the lining of your lungs and airways to have possible cancer and be cancerous. To do this procedure, a doctor would put a small needle in your ribs and remove some fluid and then send it off to see if it contains malignant cells or either cancerous, it's kind of basically a biopsy. Then also one of the main other ways that they figure out if you have lung cancer is through a sputum cytology. Doctors may want to look at a sample if your sputum, if they think you have like possible lung cancer that started in or came from a major airway of the lung, such as squamous cell lung cancer, which is a form of lung cancer it's horrible. It starts in the major airway of the lungs. To perform this test, they ask you to collect any mucus from the morning for 3 days or so like a rough estimate like that. In this slide, we'll be looking at some prevention of lung cancer and what you can do to kind of prevent the possibilities of obtaining and getting lung cancer. So one of the most important things to prevent lung cancer is to just, if you're smoking, just flat out stop, not do it. Also try to avoid around being any smoke or any secondhand smoke. Also try to stay out of some polluted areas and maybe like big cities kind of stuff that may cause exposure to certain toxic chemicals that can cause lung cancer. Also, another big thing that we were talking about earlier was getting your house checked and businesses checked for like radon and stuff to see if that's one or a chemical looming around in your house and possibly wherever, because it is, besides smoking, it is like the second top cause for obtaining lung cancer. Um, Also, lung cancer doesn't really affect, it's not really a certain race based because it's just about kind of smoking and stuff like that, and chemicals and all that type of stuff. But it mainly pertains, I feel like, if you have a family past history of lung cancer, with most cancers as well. One thing that I was looking at that can contribute to lung cancer is age. Like, for example, if you were smoking your entire life since you were like 12, the chances are way higher of you getting lung cancer when you're 60 or so because you've been smoking for 50 some years. And that's age, I think, is one of those things that you can attribute to lung cancer. Then I was also looking into um, how women have the more prevalent diagnosis of lung cancer over men, but the number and the positions have changed over the past 2 decades. They've been like fluctuating, not stable. But as of late, as of 2022, women are more prevalent in the diagnosis of lung cancer than some men. I think that partially being from possible spreading cancers like breast cancer and stuff like that. Then socioeconomic status really has nothing to do about lung cancer or like with it. It can pertain to like getting your hands on cigarettes and stuff and making sure you can get your house checked, whatever, checked for chemicals and possible dangerous stuff. Um, but yeah, that's about it for the prevention basis of lung cancer. Just really try to stay away from smoke and possible hazardous chemicals and toxic chemicals. Here are 3 of my references from the project. Here are my last 3 references for my project. Hope you guys enjoyed, and thanks for listening.